Welcome back to the Popped Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today, we are going to dive into some of the behind the scenes of postpartum recovery. Not the Instagram version, but the real, raw physiological processes that occur during postpartum that deserve respect and deserve to be talked about. Postpartum recovery does not end at the 6-week mark. In fact, for most women, the 6-week mark is just the beginning. Now, I want to be clear. I've never been through postpartum. I've never given birth, and I never want to pretend like I know exactly what it feels like to go through it until I do. However, what I do offer is this: a deep understanding of what's happening in your body, in your nervous system, and in your hormones through every phase of preconception, pregnancy, postpartum, and beyond. I've studied this stuff really closely. I've walked through the season with so many patients and so many clients, and I'm here to offer clear, evidence-based facts and evidence and support that really does honor what your body is going through all these crazy phases that so many people can't quite understand, or even women who have been through it don't understand what they went through, so it's hard for them to share and express what they went through. So I'm here to bring that all to one place so that we can build a greater understanding of pregnancy, birth, postpartum, and beyond. So let's get into it. If you are pregnant, newly postpartum, deep into your first year, or you're supporting somebody who is going through this time, this episode is for you. We are going to go through the really general, I wouldn't even say baseline, because we're going to go a little deeper than baseline, but what is actually happening what's actually happening physiologically postpartum that we don't often see the breakdown of what exactly is happening. So you've given birth. A lot of times the focus tends to go to baby, but there's actually so much happening with mom as soon as the placenta comes out. Honestly, as soon as the baby comes out, but especially as soon as the placenta comes out or is delivered, there's a whole recalibration of mom's physiological processes, hormonal processes, and physical musculoskeletal processes. So first we have uterine involution. This is your uterus contracting back to the size it was pre-pregnancy. Now, in order for it to do that, which it's going to do it naturally, your body is going to need to continue to produce oxytocin. Guess what? In order to have some milk production, you need oxytocin and prolactin to rise. So your body is going to be producing oxytocin anyways, but these contractions that you will feel like what I have heard is a lot of like early labor contractions or deep period cramps. They're quite intense, similar to contractions that you're feeling in early labor. This is going to, especially if you're breastfeeding, like I said, we want the oxytocin and the prolactin to come up if you're breastfeeding with physical touch and the actual sucking mechanism from baby is going to produce oxytocin. So this is just like a great feedback loop that the whole body needs. It's a very natural, divine way that our bodies were designed to process so that our bodies could start to recalibrate into postpartum, not necessarily pre-pregnancy body or experiences in the body, but what the new phase of this body is going to be now that we're postpartum. So next we have, and we'll get into a lot of these hormones a little bit more in just a second, but then we have some pelvic and joint instability. Since there's a lot of relaxin pumping through the body in order for the hips to expand and get baby out, to stretch all the tissues, that relaxin does linger for a little bit in the body. Now that there's no pressure or baby pushing to come out, there's loose pressure. If you think about like a full balloon and then you pop the balloon, right? There's going to be space on the inside and on the outside now. And until there's new pressure or regained strength around some other pressure, we're not going to have quite the stability in our hips that we used to or that we need to have eventually. This is why it's a good time to go to the chiropractor, because there's relaxin in your body, and because you just went through your Olympic event, labor. Who knows what positions you were in? You probably do. Your doula probably knows. Your birth partner probably knows. But all the different positions that you're in, obviously, you're contracting and having a very intense physical event in these different positions. There's going to be some new strains and stresses on your body that need to be realigned for you to be a functioning new parent. So, this is a good time to go to the chiropractor because you still have that relaxin in your body. This is the most malleable time to take care of or fix anything that's been misaligned in your body, because there's so much softness in your tissues. There's not a ton of restriction or lack of joint space. And there's actually a lot more joint space because we just went through labor. So, go to the chiropractor postpartum as soon as possible. Even if you are have a planned C-section or emergency C-section, you can still see a chiropractor. They won't necessarily work bottom down. It's usually thoracic spine and up, and that is also dependent on how the epidural unraveled in your system postpartum when you're able to get that adjustment. But nonetheless, it's really important to have adjustments so that your brain can start speaking to your body again, start perceiving new information as your body is starting to rewire and recalibrate into this new postpartum phase of body. Next, we have your abdominal wall. Most likely, it's separated. I've only had one mama who has not had abdominal separation, and I can't wait to share her story one day. But every other mom I've ever experienced has had some sort of abdominal separation. This is called diastasis recti. However, just because every mom has had it, it doesn't mean everybody's had it at the same degree. Everybody's had completely differing degrees of abdominal separation, and it requires different amounts of support and different amounts of care and rehabilitation. So, this is why my number one recommendation for moms pre-labor, I'm like, as soon as their third trimester, I'm recommending that this is purchased and ready to go, if not already on your baby registry or something, is a belly binder. This is not to be confused with bounce back culture of getting your body back. This is strictly this recommendation is strictly for the support of the abdominal muscles. Like I've said in, maybe I haven't said it in these episodes yet, but I teach about it all the time at the office. When your abdominals your abdominals support your low back. There's musculature that supports every bit of your spine and your physical being. Muscles are meant for support. So, the muscles in the front of your body, your abdominal muscles, are actually what supports your low back from having a ton of forward motion. When the abdominals separate during pregnancy, this is when we start to see a lot of anterior pelvic tilt or forward hip tilt that's swayed back because there's no support for that low back. We work on that with decompression breathing. We work on that through all of our Move Method apps. So you should be a Move Mama if you're not. But anyways, that support, as soon as your baby's out, now there's no pressure against your spine and there's no abdominal, what's the opposite word of separation? Togetherness. Your abdominals are still separated. They have not reformed back together. It's going to take a while for them to re-strengthen their fibers back together and create a nice, strong midline. That midline is also the pressure that you use to create when you poop. So, if you have abdominal separation, there's no support for your low back. And when you go to poop and there's no actual support or pressure created around your organs because they can't create pressure or contract, it's really hard to poop and you start coning postpartum, which starts pushing organs into that open space. This is where we have a much higher risk for abdominal hernias postpartum. So, get yourself a belly binder, a belly band preferably that goes over the top of your hip bones and under your bra line, so that you can create some sort of pressure for when you go to the bathroom or when your body creates that external, when you sneeze, cough, laugh, fart, all the things. When you use those types of muscles to create that pressure in your body, we really need to make sure that we have support as those abdominal muscles find their way back together. I will say the quickest I have seen abdominal muscles reform in at least engagement, not necessarily tightness or loss of belly fat, but literal ability to engage, is from decompression breathing, most often taught through foundation training. So you can always look up Dr. Eric Goodman for foundation training, decompression breathing. We teach it at Move. I teach it for my moms a little differently just because we're talking about pregnancy. So definitely something to look up. If you are a Move mom, come ask me about it and we'll make sure that you're doing that too. Next, I have breathing patterns change. Your breathing patterns, because all of your organs have been slightly shifted up, there's less space for your diaphragm to extend down when you breathe in. That's actually what is happening. Every time that you breathe in, your lungs fill and your diaphragm pulls down. Well, guess what? There's a baby in there. So there wasn't a ton of space for your diaphragm to pull down. Now that there's not a baby in there, the organs should start to shift back to their original place or relocate. However, if you're a postpartum mom, most of what I have experienced and heard of is a lot of sitting in bed in this rounded, very crumpled up, cramped up position. This forward flexed, rounded back is not allowing any space for those organs to fall back down. And this is actually the position that most people work in at a desk. So if this is you too, think about this. When you're in that crouched over position, it's the same position you would get into if you were in a fight flight situation. It's going to constantly stimulate that sympathetic nervous system, and it's going to stimulate those shallow belly breaths, that shallow diaphragmatic breath. So if you're in this position constantly and your breath is trying to re-engage for bigger, more expansive breathing patterns, but you're constantly here, we're not going to have that change. And then that starts to actually lead into more mental health, anxiety feelings within the body, too much stress, overstimulation. So uber important to focus on your posture immediately postpartum, because it really does affect not only the physiology of your breathing, but your mental state and your organ state, where your organs are able to move to and relocate. Again, with this, we have posture shifts because you're in bed a lot, because we're feeding a lot. We're in that curved over back position, which is often stimulating that sympathetic nervous system. Sympathetic is fight or flight. Parasympathetic is rest and digest. Guess what? You are postpartum. We need to rest and digest as much as possible. We're trying to heal and recover from the most intense physical event you've ever been through. So if we can't get into that rest or digest state and you're constantly sympathetic, it's going to be really hard for you to actually recover. On top of your baby, who is mirroring your nervous system exactly. So if your brain and nervous system is constantly wired and in fight or flight, so is your baby. If we're able to find more open, supported postures more frequently throughout postpartum, you can actually start to engage that parasympathetic state, and same with your baby. So this is also a side note. If you notice that your baby is in a sympathetic state and cannot seem to calm down, they're just constantly crying, look inward and see if what your state is at that moment. It is not always necessary. I'm not saying this is like your fault for being overstimulated, but there's always that chance and that opportunity to check in. Where's my nervous system? Is my baby mirroring my nervous system right now? Are they freaking out and having a stress moment because I'm freaking out and having a stress moment? As soon as you're able to engage and regulate your nervous system, a lot of times it really does help baby engage and regulate their nervous system. And not that they're doing that on their own, they're co-regulating. So if you're regulating, that means they will regulate with you. Um, bum bum bum. Let's move on. This is so my last note that I have for this was this isn't just recovery. This is a complete structural physiological recalibration inside a female's body that's happening during postpartum. Hormonal and neurological recalibration as well. Okay, so I asked a couple questions on my Instagram a couple weeks ago about postpartum, and I'm still getting answers. So the fact that I'm still getting answers, I'm going to keep those questions actually posted on my Instagram. And if you feel like you would love to answer those or didn't get a chance to before, please swipe up and answer the questions. I'll still be compiling a lot of these answers, but I had asked a question that was something like, what is the most surprising thing that you experienced immediately postpartum that you weren't expecting, or something like that? And I got a lot of answers saying the hormonal drop, the hormonal drop, the hormonal drop. And what I thought was interesting is it's not just a hormonal drop. That is definitely a big part of it, but there's also a huge change in hormonal upbringing. So I want to talk about the hormonal whiplash that no one ever discusses. And I think a lot of that is because even the women that have experienced it don't fully know what they experience. So after you deliver your placenta, and we're going to go through quite a bit, so stay focused. After you deliver your placenta, we have estrogen and progesterone. Before you deliver your placenta, starting at 36 weeks pregnant, when you are full term, you are pumping more estrogen in one day than I or an average female who is not pregnant will pump all year combined. With all of the menstrual cycles, with all of the hormonal ups and downs, in one day you are pumping more estrogen than I will all year combined. That's a lot. As soon as you deliver your placenta, estrogen and progesterone go down by 90% within 24 hours. So you go from pumping that much in one day to pumping less than I am probably actively pumping at the moment within 24 hours. That's huge. That is such a big shift. That alone can cause mood swings, anger, rage, sleepiness, that weepy feeling, that uncontrollable weepy feeling. That's a huge part of this. So estrogen, progesterone goes down a lot. We also have pregnancy-specific hormones like HCG and HPL completely vanish. If I just said vanish, I meant to say vanish. They completely vanish. Then we have cortisol and adrenaline, which spike during labor, even in our highly stress managed, like low stress environments, home births, even in our very low stress environments, there's still going to be a peak of cortisol and adrenaline that comes into the body during labor. As soon as you deliver, all of that crashes, and it typically leaves you feeling jittery or completely depleted. We have prolactin and oxytocin, which I talked about earlier, do start to surge as soon as the placenta is delivered so that we can start producing milk. However, if you happen to be in an environment that you didn't feel super safe in during labor and birth, if you still do not feel that safety, or you're not getting to a place where you feel safe, safety or comfort, it's really hard for this oxytocin and prolactin to surge. When your body feels supported and safe to do so, those hormones will start to surge so that you can start to produce some milk, which triggers some of those contractions so that your uterus is also contracting back down to its pre-pregnancy size, but now in its postpartum glory. It's like your body is on a hormonal rewind, except instead of taking 9 months to get there, it happens in about a week to 2 weeks. That's huge. So if you find yourself crying at unexpected times, or can't stop crying, or just feel disconnected from yourself or your body even, your entire hormonal identity has just shifted. So give yourself some grace. I know that's much easier said than done, but being aware of how much is actually happening in your body, I think can help a lot of moms to understand, like, this is not just me going crazy. I'm not a lunatic. This is my hormones having a massive shift in my body now that I'm postpartum. And I just want to say this, your experience is valid, your response is intelligent, your body is doing incredible, complex mechanisms and physiology processes to get you to where you are every day, but definitely postpartum. So, even if no one has warned you about this massive hormonal shift, hopefully this can give you a better insight of to what actually happened or what might happen for your postpartum experience. Let's zoom in on the 6-week postpartum check-in. The checkup that most women are told they are cleared. Cleared for what? This checkup was designed in a time when women were being checked if their uterus had fully contracted back down to size and if they were done bleeding, physically stable. Never checking to see if they're functionally or emotionally stable. If I could make my dream postpartum checklist, it would include a pelvic floor exam to assess tone, trauma, prolapse, and function. Depending on your birth, you might need that. A diastasis recti screen. I thought about saying this in this episode, like, go ask your chiropractor, and I realized not every prenatal or postpartum chiropractor is maybe checking for that. We definitely check it at Move, but that is something to possibly ask about. More one of your body workers. I just feel like body workers who are in and around and know how your body functions and works together is probably the best person to help give you some support or some guidance in how to regain strength and control of that core. I have spinal and postural assessment. That's actually my number one. There's such a big shift during the actual start and end of labor and start and end of birth. Like, all of it is so much on your spine and your nervous system. That's the first thing I would get checked. I have a lot of parents who have me come to the hospital as soon as their baby is out, and I usually check the baby. There's quite a few parents who also have me check their spine. A lot of times we're checking their upper cervical spine, where a lot of the brain function to body function communication is happening, to make sure that at least up here, while they're in a kind of a usually crinked bed, at least this is working. And then I've been to a couple home births postpartum to make sure that everybody has their spines checked and everybody is ready for a postpartum healing recovery. I also have an intentional and meaningful mental health screen. I know that's not always the easiest to find, and sometimes you do have to search through a couple providers to find one that really meets with your needs or aligns with your beliefs and your views, and somebody that's really going to truly support you. And that is just that is it's how you find your best hairstylist, right? We're working with somebody who's working with our mental state, so it's really important that you find somebody that truly aligns with the support that you need to recover. Conversations around sex, intimacy, and pain, super important. I have a lot of moms that come in immediately postpartum. They're like, what do I do? Talk to somebody, bring it to your chiropractor, bring it to your physical therapist. A lot of these have to do with pelvic tone, the tone of your pelvic floor, which is controlled by the nerves of your low back. So if we don't have proper nervous system control in our pelvic tone, it's going to be really hard for our pelvic floor to recalibrate and heal properly for these intimacy times and feel good. So definitely something to talk about and something to work on movement wise. And then finally, I have guidance on movement, rest, and emotional needs. Everybody's different. Everybody is different. And I really do believe that everybody deserves personalized movement, rest, and emotional recommendations and care. But I think also a lot of that comes from asking yourself, what do I need and what can I give myself? What do I need and what can I give myself? What do I need and what can my partner help me with? What do I need and what can my mom help me with, or your support team? A lot of these I realize are not always in the means for everybody, but this is why I said this was my dream postpartum checklist. If I could have everything taken care of, checked out, or felt supported by, this is everything I would probably go through. Moving on, we have some symptoms that are common but not normal. So let's break this stigma right open. Just because it happens to a lot of women does not mean it's normal or that it's something you have to deal with. It's just common. And we have a lot of common things in our society now that aren't normal. I could go on a rant for days about that, but we're going to tie it back in. We're going to come down. Leaking when you sneeze, cough, or laugh. That is common. It is not normal. We have pelvic heaviness or a feeling out sensation. Common, not normal. Pain with sex or internal discomfort. Common, not normal. Abdominal coning or lingering instability in your core. Common, not normal. Anger, numbness, anxiety, or panic that doesn't ease. Common, not normal. All of these are a sign of either pelvic floor dysfunction, diastasis recti, nervous system dysregulation, hormonal depletion, all of which can be cared and supported for. It's not about perfection, it's about support. It's about recovery. It's about recognizing that your body is asking for support or something that you're allowed to give it. One of my really close friends, Nicole, I'll give her a shout out. She's such a strong voice for women. And recently in one of her posts, she talked about how she will always say and stand on her hill that an angry mom or a raging mom is an unsupported mom. Not always to say that your partner or your family is not supportive, but there are always areas to find more support. And if you find yourself in one of these deep emotional states that you cannot pull yourself out of, chances are you're missing support somewhere. Let's shift the focus from getting back to building forward. Healing isn't just about feeling okay. It's about restructuring and rebuilding the systems that helped carry, grow, and birth your baby. The part that most people miss, while moms are cleared at 6 weeks for physical activity or whatever that means, tissues, joints, ligaments, tendons, muscles, movement patterns take closer to 9 to 12 months to completely recover. And that's if you have the right support. So let's break this down a little bit. We have ligaments and joints that are softened by relaxin to help you deliver your baby. That hormone sticks around, especially if you're breastfeeding, which causes or allows your joints to remain unstable or in this instability state for a while. This is your hips, your low back, your pelvis, your sacrum. This can last up to a year postpartum. The pelvic floor is stretched, some more, some less. It needs time, movement, and often hands-on therapy to regain its tone and tension. This is the pelvic floor tone that you need to help keep you from peeing or leaking your pants every time that you cough, sneeze, or laugh. So then we have your abdominal wall, which usually still has some separation and weakness, which affects how your core will stabilize. Every time that you pick your baby up, put your baby down, pick up your groceries, all the stuff that we use when we engage our core. This affects your posture, your breathing, and your load tolerance from what you're doing in pregnancy to carrying your baby and all the new stress patterns. So it's going to take time to rebuild the strength and integration and integrity of your core, your low back, and your spinal support all year. It's a long time for these musculoskeletal changes to actually have a big shift. When we talk about postpartum healing, we're not just talking about stopping bleeding. We are talking about nervous system regulation, movement that rebuilds, realignment, nourishment, and being seen. I'm going to go through each of those. We have nervous system regulation. You can include breath work, co-regulation. This is co-regulating with your baby. We've got chiropractic care and rest. We've got movement that rebuilds. You can use your breath, more breath work, deep core work, and finding your center of gravity. Realignment and rehab is learning how to move, lift, carry without pain. My best recommendation for that is through foundation training if you're not in Boulder, Colorado and not already part of the Move Moms program. Go through foundation training. They have really great core work. If not, come see me. Nourishment that feeds your hormones and your healing. So not just lots of calories, true grounding, authentic nourishment. If you're looking for more nutrition or a nutrition specialist, there's a ton of postpartum Ayurvedic birth workers that really are super beneficial in helping you structure what you need for your body so that you are actively healing and progressing, building upwards. And then being seen. This one's important, not just being seen by your practitioners, but yes, one, being seen by your practitioners that you saw during pregnancy. I think it's one of the best full spectrum doctors you can have. If you're having doctors that only look at you at pregnancy and doctors that only look at you postpartum, they're not getting to see the full spectrum of where you've come from, what you've gone through, and where you're going. So that's why I always recommend having a chiropractor on your team of go-to people so that they can help you finish this arc really gracefully. Anyways, not just being seen by your practitioners, but being seen by your friends, family, and your loved ones. Being seen by your friends, family, and loved ones. These are so important because these are the people that can truly build your village and help you. I say it all the time. The world, this like, what's the saying? Oh, it takes a village to raise a baby. That saying always gets me because I work with moms and I so often, as much as baby, yes, might need a village, mom takes care of that baby so well. I'm not worried about that baby getting the care that it needs. I'm worried about the support for mom. It takes a village to raise a baby, but it takes a village to support a mom. So find your village, ask for help. If people are just saying no, that's crazy to me, and they probably shouldn't be in your village anyways. But the people who want to help and the people who should be there and want to be there will be there. Just ask for help. Set up a meal train. Set up a visit train, a doggy sit train. I saw that once with one of our moms. They had come and hang out with our doggies train, and people just would sign up for an hour to come hang out, maybe take the dog on a walk, maybe visit with parents, but focus was to get the doggies some care and the love that they deserve that they were getting postpartum. Postpartum is slow. It's sacred. It's not linear. It's worth being supported. If this episode is resonating with you, it's probably your body or your nervous system telling you, I need some of this, or I need more of this. So you don't have to wait for a crisis to get the care that you deserve. In fact, it's probably too late at that point. I always recommend preemptive care, preventative care is the way to go. It saves money, it saves worry, it saves stress. It's typically a lot cheaper. Who might be helping you on your postpartum support team? Just because it's not specifically recommended to you does not necessarily mean it wouldn't benefit you. I'm going to say that again. Just because a specific provider in this list was not recommended to you does not mean that they would not be of benefit to you. I think a lot of times we have to be careful what I say here. We have some different generations in our providers and different beliefs in our generations. And so I think sometimes some of our recommendations or certain practitioner recommendations are missed because it's outside of that practitioner's belief. So always do your own research and lean into what you feel like you need. That will only build your intuition. Every time that we say no to something that we feel deep into our core, we break off a little bit of that pure intuition that our body has. So every time that you can lean into the intuition, the more you can build it. Here's our list. I have postpartum chiropractor. Come see me. If you can't, look in your area for a postpartum chiropractor that can help you. If you haven't already been seeing a pregnancy chiropractor and now you want to see a postpartum one. If you've been seeing a prenatal chiropractor, go see your prenatal chiropractor for postpartum care. Most often they do offer postpartum care and they do want to see that arc and help you through that postpartum transition. It's usually a lot longer than your pregnancy transition. But anyways, we have a pelvic floor PT. I do want to note pelvic floor PTs. I don't know if all of them, depending on the state that they practice in, if all of them do this, but this is something to note. A pelvic floor PT will have an internal exam. So they will enter your vagina or your birth canal to do an exam and usually provide some care or treatment. So keep that in mind. If that's something that's really far out of your comfort zone, maybe don't. We have a prenatal or a perinatal mental health support. And that is important to me. There's tons of mental health support out there. Perinatal is going to be a really vital specialization for moms, right? You need someone who really understands the hormonal shift and the brain chemistry that's shifting as you go through postpartum. You need that support. We have lactation consultant. Again, a lot of times hospitals have them. A lot of times birth centers have them. I help a lot of our moms with lactation support, whether it's posturing of the baby, tongue ties, cheek ties, stuff like that. So ask your chiropractor. Oftentimes it's 1 to 2 to 3, sometimes 10. I don't know. I don't want to put a number on it. Adjustments away from help versus snipping, changing to bottle feeding, doing triple feeding. Talk to your chiropractor, see if there's any holistic ways that they can actually provide some body work for either mom or baby to help encourage that breastfeeding. Or call a lactation consultant. Lactation consultants, obviously that's their specialization. We have some really, really amazing ones in Boulder, specifically at the Boulder Birth Center. They're awesome. So we also have a functional nutritionist. There's tons of these, and I'm not just going to say just functional nutritionists because sometimes they're not advertised. Ayurvedic postpartum meal prepping. Sometimes they'll come to your house, sometimes they'll prep meals and it's delivered to your house, but it is a more primal, really healthy. It's really clean. It's really nutrient dense in what a mom's uterus, brain, nervous system needs to recover from labor and birth. Postpartum doula. They're awesome. They will help. Some of them definitely have that Ayurvedic specialty baked into their package. Some don't. Everybody's different. That's why it's important for you to know who you're working with. But they can also, there's some postpartum doulas who provide night services. There's some that come multiple times, some that only come a couple times. There's a wide variety of postpartum doulas and what they offer. And then we have a mama circle. We just had Sarah, who you guys, I haven't talked about quite yet, but she's amazing and she will be on this episode, or she'll be on this podcast eventually. And Nicole, who I just talked about, they just put together and hosted a mama birth story circle. So beautiful, so amazing. I can't say much because I was not a postpartum mom, but as an outsider looking in, it was really beautiful to watch and hear so many other birth stories that there was such a wide variety of experiences and feelings, and I thought that was really cool to listen and learn. And if I was a postpartum mama, I thought this for me would feel healing. So if that's something that sparks your interest about being around other moms or just engaging with a couple other moms. Maybe find a mama circle. There's a million Facebook groups, but there's also groups in and out of a lot of the practitioner offices that you've probably already been in. For example, a chiropractor office. Like, we have mom meetups all the time. So they're definitely out there. Even just one of these aligned providers can make a huge difference. Make a huge difference in your postpartum recovery, in the support that you feel, and your ability to be the best new parent that you want to be. And I understand that access can be limited for some people, and not all of these providers are in everybody's wheelhouse or in their affordability bubble or whatever it is. I get that. I really do understand that. So I come to you with a solution. If access is limited, start small. Call a friend, text a friend. I FaceTime most of my friends when I want to talk to them because I just want to see their faces, but FaceTime is great. If you don't want anyone to see your face, call a friend. Text them, hey, do you have some time to talk? Or, hey, can we schedule a time to talk this week? I feel like we're in this portion of culture where talking on the phone for long times is not ideal. It's a part of a lot of people's jobs, and so they don't necessarily want to do that with their friends. They just want to talk in person. So try to call a friend. It's going to be better than you ever thought. It'll probably be a much longer conversation than you thought. And maybe not if you have a baby on the other side, but you also have that. If you don't want it to be a long conversation, you have a baby on the other side. You can always say, hey, I've got to go. My baby's crying, whatever it is. Ask questions. I post a lot of questions on my, or I pose a lot of questions on my Instagram for my followers to ask questions back or answer or give their experience. And I know a lot of other providers do this, a lot of doulas, a lot of midwives, a lot of birth practitioners in general. So when you see questions posed or polls being taken, or you see a really interesting topic that's being talked about on Instagram or something, send them a DM, ask them a question. If a question comes up, just ask a question like, hey, for example, I saw somebody like, I'm finally feeling so mentally stable. I am rocking motherhood. I can't wait to keep doing this. If maybe I felt like I needed some support, I could DM her a question. Hey, what different tools did you use to get to this place? What other support tools did you use? I'm looking for some more support, and I'm just curious what you did. And just ask simple questions. Ask anybody and everybody, but just start throwing them out there. Ask questions, see what you get back, add it to your information bank, and you can use it or not. And then listen to your intuition. I think this one can be difficult because in postpartum, how often do you have time to sit there by yourself and listen to your intuition? It's not frequently, if at all. So, if anything, this is now my invite to schedule 5 minutes, even if it's just that 5 minutes once a week, to sit and listen to your intuition. What is my body telling me? Check in with your body. Where do I need support? What's frustrating me? What's bothering me? What's making me feel really good? Do some sort of intuition check-in once a week at minimum, just to see where you're at and where you need support. And then if you can act on that support that you need or ask for it, you are going to build that intuition tether that we so naturally have in our bodies stronger and stronger and stronger. If we never check in with our intuition, or we do check in with it, but we don't act on it, our intuition tether from mind to body only shortens or decreases. So we really want to build and elongate our intuition tether, especially now that you have that mom or that mother's intuition. We want to make sure that that stays nice and strong for your child's life. So listen to your intuition, give yourself time to check in with that intuition and what it's telling you, what you need, at least once a week. You deserve to feel supported. Every mom deserves to feel supported. And I wish I could support every mom in every facet of every way that they need, but I can't. So this is my encouragement to you to find people to help you with that. I wish I could make 1 million of me and pass them out to every mom so that they could just have someone cleaning and someone changing the diaper and someone giving her a second to check in with her intuition. I wish I could do all of that, but I can't. So this is turning the tables. This is your opportunity to go find that support. Search for that support and don't stop searching until you find it. If you search for it and you don't find the right person, keep searching. Don't mark it off. I always give this analogy. If you had a bad haircut, are you never going to get a haircut again? No, you're just going to go find a new stylist. So if you really can't jive with a certain person, don't just totally forget about that form of support. Look for different people in that form of support. Let's finish this. That was a really good episode. I feel like we got through a lot. But there's no deadline to postpartum. No deadline. 6 weeks is not your deadline. That's usually your start line. It is a season. It's a long journey. It's a process. It's a lot of processes. It's integration. It's healing. It's becoming. It's a lot. It's a lot happening. Even though I haven't lived this personally, I see you. I respect you. I respect this transition. And I'm here to always bring awareness, offer tools, education, and support for wherever you're at. If you enjoyed this episode, please like, subscribe, comment, leave us a review. And as always, if this episode resonated with you, or if you know somebody who could really benefit from this episode, please pass it along, share it with your friends, share it with your birth providers. Go check out my Instagram questions that are up on my highlights. If you have any answers or you're a postpartum mom and have any insight, we would love to learn from you. I won't share your name or your information, but it will just go into our bubble of experiences that we can share with other moms, so that they know what to expect walking into their first 40 days postpartum. I'm Dr. Emily, and you've been listening to the Popped Podcast.